As masking and social distancing eased up post-pandemic, health experts say it's allowed respiratory illnesses to thrive. RSV hitting young kids, the elderly, and the immunocompromised especially hard.
It's coming at the beginning of the flu season as well, and we haven't gotten rid of COVID either. So it's a combination, sort of the triple whammy this year.
Now, hospitals around Portland, Oregon, and really the whole country are overwhelmed, in particular the pediatric units. Dr. Marianne Parsley, president of the Oregon Medical Association and a primary care physician in East Portland, explains.
If there aren't beds because they're all occupied by the RSV patients, it becomes really tough. And if you're talking about having to reassign staff to the pediatric units, then you have trouble staffing the adult units.
This week, OHSU Dornbecker ran out of pediatric ICU beds, and Randall Children's is postponing some non-urgent pediatric surgeries. Because they're in crisis mode, some patients in need of critical care are also being transferred to other hospitals.
I don't think that the hospitals in general are at the place they were at the peak of the Omicron surge, just because that tended to be more adult care and adult ICU care. But for the pediatric, there are less pediatric beds in the hospital because kids don't get sick at the same rate as adults do. And so they have fewer beds, fewer ICU beds, and therefore the capacity is being strained because of what we've got.
Since the vast majority of children who get RSV will have mild cases, doctors urge families to check with your primary care physician first and avoid the ER unless symptoms turn severe.
If the child is febrile, if they're looking like they're getting tired, if they're short of breath, if they're wheezing, absolutely take them to the emergency room, please.
Now, it's worth mentioning that compounding these problems is a shortage of amoxicillin, the antibiotic used to treat many respiratory infections. As we kick off the holiday season, health experts say it's important to remember not to be around other people if you are sick. Consider wearing a mask around vulnerable people and, of course, wash your hands.